Hello, I'm Max Robbins, Chief Executive of CHT. We're now on to day 3 of our COVID-19 lockdown, and over the last few days we've had lots of questions and comments from families who have voiced their fears and frustrations. I intend to make some regular videos to try and keep you up to date with what we're doing at CHT, in addition to the emails that we send out and the information that we post on our website and other communications that we have with families. Today I want to start telling you how we're managing this crisis and how we're managing new admissions. There will be further updates in the days ahead. In discussion with families of our residents, there are 2 themes which emerge very strongly. The first is the sense of loss, as people are deprived of the time to have face-to-face contact with their loved ones. And the second is a feeling of frustration and powerlessness, as people feel there's nothing that they can actually do to get control of the situation and carry on in the way in which they would like to. The best thing that you can do is to stay at home and look after your own safety, so when the lockdown ends, you're in a position where you can visit us straight away. It's absolutely essential that during this time, communication between you and your loved one is facilitated by us to make it as easy as possible for you to connect. To this end, we are asking people who have cell phones or tablets that they could drop off for their relative or family member to be brought to us. We have a strict process in place where we require you to clean that device. There are some guidelines on how to clean devices on our website, to bring it in at a pre-arranged time so that someone would be available to pick it up. That will be handed to someone to do a clean inside the facility, and then we'll put a label on it and take it to your family member. There are some things which we can't allow to happen on the site. People have asked whether they can bring in food, and whether they've asked they could bring in and drop off and pick up laundry. We can't allow people to visit to drop off food, and we can't allow people to visit to drop off and pick up laundry. We want to reduce the risk of contact between our residents and people outside of our facility and our staff, so that everyone is kept as safe as we possibly can. The one exception to the visitor policy is that if a resident is palliative or is dying, then the family may arrange a visit to that resident or visits to the resident, usually on a one-to-one basis, and we have to follow Ministry of Health guidelines to do that. In order to arrange those visits and the procedure for those visits, you will need to talk with the manager of each facility. One of the things that people have raised with me is concern that if we do the laundering for our residents, is there a risk that it will get contaminated by someone else's laundry? Our laundries have been set up with the best infection control procedures in place to avoid anything that would lead to cross-contamination, and therefore we can safely say that the laundry will not be a source of contamination from between residents. We've issued recently guidelines for what personal protective equipment, what PPE, our staff should wear. There are many opinions out there about what people should be wearing in healthcare environments and how you should be kitted out. Lots of people are suggesting someone needs to be fully masked and fully gowned and so on. But the guidelines that we are promulgating to our staff have been developed by nurse leaders in the aged care sector in conjunction with the Ministry of Health and infection control specialists, and they've drawn upon international best practice to guide them in the development of those guidelines. When someone is admitted to a CHT facility over this crisis period, then we will be requiring them to go into isolation for 14 days. What does isolation mean? It means that the person will have to go into a bedroom with an ensuite and not be able to come out of that environment for the 14-day period, and that when staff go in to look after them, they will go in with appropriate personal protective equipment. We will only be admitting people who do not have symptoms and are not known to have COVID-19, but this isolation policy is an extra layer of protection in case there is some undetected case that comes through into the system. I know that this is an extremely distressing time for you, and that it's so hard to be at home and not be able to do what you would like to do. We will do everything that we can to look after your family members safely and keep them well, and keep our staff also safe and well. Take care and goodbye for now.